Thanks for staying with us. Heart disease is an equal opportunity killer. It's the #1 cause of death for both men and women in the U.S. Dr. Susan Schima with Mercy Cardiology Clinic has more on this. When you think about heart disease and heart attacks, we typically get in the habit of thinking about men, but it really affects women as well.
Absolutely, yes. Heart disease does not discriminate based on sex. In fact, it's estimated that 90% of women between ages 40 and 60 have at least one cardiac risk factor. Risk factors are things such as your age, your cholesterol level, whether or not you have hypertension, whether or not you smoke. It's important to talk to your healthcare provider about what your risk factors are so you can start to mitigate those and avoid any potential bad outcomes.
What are some of the signs and symptoms that might be more specific to women than men?
Okay. Well, actually, for both men and women, the most common sign of a heart attack is chest pain. And a lot of my patients actually correct me on this and say it's not a pain, it's more of a pressure or tightness. Now, having said that, though, women are more likely to have atypical symptoms, and these would be things such as jaw or neck pain, shortness of breath, extreme fatigue, nausea, vomiting. Anything like that would warrant a trip to your physician emergently.
And that can be kind of an alarming thing because you look at these overarching signs and symptoms, you may not see something like jaw pain on the common list, so you may rule out heart attack when in fact you need medical help.
Exactly, right. Any symptom that comes on and is out of the ordinary for you or is associated with other symptoms such as you have jaw pain and you're also short of breath, you should urgently seek medical attention.
Sure. So what are some ways that we can be, as women, proactive about having good heart health?
Okay, well, first of all, like in life, there are things you can control and things you can't. And certain risk factors we can't control. Our family history and our age we just are stuck with. There are a lot of things you can control, however. The other risk factors are things like your diet. Everybody can eat a healthy diet.
Sure.
You know, a lot of us kind of eat our way into a lot of health problems and disability, but you can eat your way back out of those too. And just focus and make some healthy changes in your diet. Exercise is key. Everybody should get at least 30 minutes of exercise 5 days a week. If you smoke, you need to quit. There's just no
other way to put it.
Exactly, exactly. No excuses.
And as part of Heart Month, which February is, you have a female-focused event coming up at Mercy. Tell us a little about that.
Yes, it's Coffee with a Cardiologist. It's going to be next Wednesday, the 19th, from 9 to 10 at Mercy Medical Center. And I will be giving a short presentation on women and heart disease and then just answering questions. It will be kind of an open forum about heart disease.
Wonderful. And to register, you can just go to Mercy's website, look for the events page, and get registered for that event. Well, thank you so much for coming in today, Dr. Schima. We appreciate it.
Thank you for having me.